Welcome to the Institute of Natural Health and Education, Continuing Education Division. This presentation is for educational purposes only and not a substitute for professional medical advice or diagnosis. Today, we're going to be talking about a specialized clinical massage for shoulder pain. And during this presentation, we're going to have an overview of the anatomical structures of the shoulder, common symptoms associated to musculoskeletal imbalances of the shoulder region, methods to specialized assessment procedures, integrated approaches to treatment, clinical application of massage techniques to assist on the correction of postural deviations. Also goals to restore balance, decrease muscular discomfort, and enhance patients' range of motion. Here, what you see is a general x-ray of the shoulder region or the anterior shoulder region, showing the head of the humerus and the scapula, and also the clavicle region. That is where we're going to be covering some of the areas which will be the brachial plexus and the pectoralis minor located. Here is the general review of the shoulder bones. As you can see, the scapula, you see the posterior view of the scapula on the left upper corner, and then the anterior view on the upper right section of the presentation. And the bottom one, it will be in the center, will be the posterior view of the areas of the scapula or shoulder blade. The primary muscles that we're going to be talking about here that covers the shoulder will be your teres minor, and you have the subscapularis, and also supraspinatus and infraspinatus muscles. Then those will be the sit muscles, along with the deltoid muscles, which will be the anterior deltoid, posterior deltoid, and medial deltoid. That stabilizes the shoulder and provides the shoulder with the ability to move in so many different directions. As we continue with the shoulder muscles, we're going to be talking about that all the muscles are connected to the clavicle and the trunk, along with some of the other aspects of the shoulder movement, which includes the trapezius, the levator scapulae, the rhomboid, that has the origin on the base of the skull, and then the spine that connects to the scapula, to the clavicle, and also to the trunk part of the body there. Also, the pectoralis minor, pectoralis major, minor, and latissimus dorsi muscle, teres major, and the deltoid that connects to the proximal end of the humerus, and also connects to the body of the anchors into the body itself. As we continue with the shoulder muscles, we need to look at the four rotator cuff muscles that I briefly spoke about: the subscapularis, supraspinatus, infraspinatus, and teres minor, which connect the scapula to the humerus and provide support to the glenohumeral joint, which is the joint between the scapula and the upper arm bone, which will be the humerus. Muscles of the arm there that enter into the shoulder complex are generally separated by its anterior flexor areas and the posterior extensors compartment. This includes the bicep brachii, the triceps, and the coracoid brachialis. What you see here, it would be the brachial plexus, which, as you can see based on that picture, it goes underneath of the clavicle. And for this picture here, the pectoralis minor was removed, so we can actually see the brachial plexus, which is a bundle of nerves and blood vessels that goes down on the arm or in the brachial region. So it goes underneath of the pectoralis minor. Also, you have a general idea of some of the other nerves that actually provide nerve conduction to the arm region, and you have nerves that will conduct nerve impulses to the anterior brachial and antibrachial region, and also a nerve that will be on the posterior region of the arm. As we continue with this, I want to talk about a little bit of a compression of the nerve of the brachial plexus at the shoulder region, which a lot of times it can be identified as TOS or thoracic outlet syndrome. That causes radiculopathy or arm pain, which is a term used to describe radiation of the pain down to the arm. It can be begins through the neck region and runs down through the shoulder and then goes down on the arm. Sometimes go all the way down to the hand, and then associated with a kind of like a neurological deficiency such as numbness and weakness down on the arm, and that is generally the TOS area. Here you have a little bit of the view of some of the blood vessels that go down from the TOS, so the thoracic outlet region, down to the front or the anterior arm region or the brachial region. Some of those blood vessels, when they get compressed, they can cause what we call ischemia, which is a condition of the muscles that is kind of appropriate, is just related to the decrease of delivery of oxygen to the arm muscles. This a lot of times the shoulder protraction, which is the shoulder going forward, which becomes a faulty posture, which then can be associated to too much tension on a pectoralis minor. That causes this shoulder to go forward, compressing the brachial plexus, which then creates this feeling or what we call the ischemia to the arm region. Some of the other things associated to pathology of the shoulder would be rotator cuff issues. Sometimes one or more muscles of the rotator cuff or the sits muscle can be damaged, causing this problem with the stability of the shoulder movement. A lot of times creating pain when a person tries to move the shoulder. In this case, there are so many different things. We talked about that there's different ones, so like tendonitis, for an instance, which is can be caused by overuse of the rotator cuff muscle that causes the inflammation or the tendon. Tennis players can also be pretty much more common or more prone to develop those kind of problems with tendonitis. As we continue with this, we get another condition that involves that is the bursitis, which is a common uh, situation happening with a rotator cuff injury. It's caused by inflammation of the bursa sacs, which are little structures within the joint. It's our fluid-filled sacs that sits between the rotator cuff tendons and the underlying bone area of the shoulder. Additionally, another condition will be rotator cuff strains and tears caused by overuse of acute injury of the shoulder or sometimes even the rotator cuff. So the tendons that connect the muscles to the bone can be overstretched or strained, and they have a tear or tear of the tendon, partially or completely, depending on the situation. The rotator cuff can also have a development of a scar due sometimes to scar accidents or another sudden injury that can happen with intensity of the movement on the shoulder area. Some of the assessment that we use for that is generally observation of the shoulder alignment, making sure that the person is not developing abnormal postural deviation, such as shoulder protraction or pain upon movement, depending if you're doing a shoulder abduction, adduction, rotation, internal or external rotation. Some common rotator cuff injuries that we should look into is avoiding certain activities because they cause pain. A lot of times they just don't move it. Every time they try to do a movement to the shoulder causes pain that they stop moving. A lot of times it's called frozen shoulder because every time it's painful when you're trying to move it, you just try not to move and it becomes tense. The muscle will tense up for protection. Also, it can be very difficult for range of motion of the shoulder when this is happening. Um, a lot of times they have people complaining about sleeping on that particular affected shoulder will be very uncomfortable, and they have tenderness of pain when they're lifting the arm upward towards the head. Pain on the shoulder can also be associated more at night, depending on the situation. And then you have a progressive weakness of the shoulder, and trouble reaching behind the back and causing pain also when you're trying to reach to the back of area like towards the shoulder blade of your the middle of your back. Now, we have to understand what primary and secondary tensors are. Primary tensors are the shortened and tight muscles in a concentric contraction phase. Take the joint to a specific abnormal position. In this case, if we're talking about shoulder protraction, which is a forward shoulder, the primary tensor in that case that we're going to be looking into will be the pectoralis minor. Now, the secondary tensors are the ones that are actually fighting against the primary tensors. They are under eccentric contraction, so meaning that they are being contracted, but at the same time being stretched. So in that case, they are called the secondary tensors. And what happened with them a lot of times is just that if it goes for a long period of time on the eccentric contraction, they develop ischemia, which is pretty much a it's a decrease of blood flow to a specific area when the muscle is compressing over the brachial plexus in this case and not providing enough blood flow to the arm muscles. That can cause, hand pain, a lot of times tingling feeling, numbness. Those things can happen when that pec minor is too tight, compressing the brachial plexus right at the thoracic outlet region. And that can be identified by just looking the shoulder deviation to see if the shoulder is going forward. In this case, as you can see in a picture, you have two differences here. You have one on the right-hand side, which is the example of a shoulder protraction, with shoulder being forwarded. The one on the left would be, and left shoulder would be elevated, which is tension on the upper trapezius. And then you have a shoulder retraction on the right with a depression, which is will be the rhomboid and also latissimus dorsi, moving the shoulder downward. Now, a lot of times occupational muscle tension, which means that people just due to occupational reasons, you're working on computer all day, desk work and things like that, it makes that shoulder to go into a protraction or forward movement. Also, frozen shoulder, which happens when you're trying to move the shoulder and it's painful, and then the muscles will tight up to stop the pain and protecting the area. So a lot of times the massage therapist will need to identify the presence of the possible postural deviation. Is this related to a postural deviation due to occupational muscle tension, or is this just due to an injury? After that is done, identifying if which ones are primary, which ones are secondaries. As we covered previously, the primary will shorten and be tense there, which those can be actually massaged and stretched. The secondary tensors are now an eccentric contraction, which in that case is still contracting against a stretch, and they should not be stretched, only massage only. Now, other things is identifying to see if this is not is a situation of a tendonitis, which is done on, basically, uh, if you provide more pressure into the movement or trying to move not related to the muscle but the tendon itself, creating the discomfort as you're trying to move that shoulder to a specific position. Um, in that case, a lot of times hydrotherapy, such as contrast application of the affected area, can be very, very helpful on the healing process. In addition, therapists can use topical liniment that act with a little bit of an anti-inflammatory properties to help along with the massage therapy application. Another situation that happens is bursitis that can cause an inflammation of the bursa sac within the areas between the tendons and the bones. Prior to beginning massage and providing the massage therapy, you should be holding the humerus and manually push that humerus against, or pretty much you're just compressing the shoulder joint a little bit to identify, because what you're doing that now by compressing the shoulder in, by pushing the arm into the shoulder blade, is just providing more inner pressure within the joint to see if the bursa is already inflamed and affected. By providing more pressure will cause an increase of pain. By pulling it out or stretching the arm bone, the arm area away from the shoulder region, If it decreases the discomfort, it could be identified or connected to a possible bursitis or inflammation of the bursa. So in that case, of course, all the massage techniques and the hydrotherapy will be beneficial, but avoid pushing the joint or compressing the joint end. The rotator cuff strains and tears, particularly the sit muscles, can be affected with that. Um, After you have identified based on allowing or asking the client to move to a specific direction or shoulder into a specific direction to identify which muscle is actually creating the discomfort upon the movement and which muscle is related to that particular shoulder movement. Then you can just target a little bit more with topical liniments, hydrotherapy, and some soft tissue mobilization. At the very end, we have some case studies that I will recommend for whoever is actually watching this presentation to analyze those four case studies and trying to come up with a procedure of an assessment and a proper treatment for all four of them. So I'm not going to specifically cover each individual case study, but this is just a exercise practice exercise for this presentation.